Welcome, everyone. My name is Adriana Machado, and I'm the founder of Briyah, a benefit corporation based in the US that bridges innovation, practice, and purpose to inspire leaders to transform organizations and create an impact economy. And what do I mean by impact economy? So that which pursues financial returns alongside positive impact for people and planet. Yes, it is possible, and Briyah is just a small example of business as a force for good. And this is Briyah Institute's leadership lesson. This is a series. We've already had a couple episodes, and this episode today is with Vera Cordeiro. So it's my pleasure, Vera, to have you with us today. Thank you so much.
I'm so happy to attend this interview.
Thank you, Vera. So who is Vera? Let me introduce her with the bio, and then I'll ask her the question. But Vera Cordeiro is the founder and the chairwoman of the board of DARA Institute. So Vera was born in Rio de Janeiro, graduated as a doctor, a general practitioner in 1975 from the Federal University of Rio de Janeiro. In 1979, she founded the Psychosomatic department of Hospital da Lagoa. In 1991, she founded Associação Saúde Criança, more recently renamed DARA Institute. So what is DARA? DARA is this amazing social organization based in Rio de Janeiro, working with a pioneering methodology to promote the well-being of socially vulnerable families. Most importantly, the methodology developed by DARA has been studied by researchers at Georgetown University and confirmed to be highly effective to empower families to move away from the vicious cycle of disease and extreme poverty. So over the course of 27 years, Vera has enabled the creation of 23 similar NGOs near public hospitals in six different states in Brazil, and trained other social entrepreneurs around the globe. So this methodology has been spread to other countries. Vera has been awarded various prizes by institutions from around the world as well. So she is an Ashoka Fellow, a Skoll Foundation awardee, a Schwab Foundation social entrepreneur, an Avina leader, and a member of the World Council of Ashoka, also a member of the Academic Medicine of Rio de Janeiro. More recently, she's also board member of PATH, a catalyst for global health. So this is just a bio, but let's hear directly from Vera. Vera, who are you? So who is Vera Cordeiro in your own words?
So I will try to answer it. That very difficult question, but what can I say? Since I was a child, I was very sad, very upset with inequality. I remember when I was very little, 4 years old, 5 years old, I was aware about inequality, surrounded by poor people in Bangu, where I lived when I was a child. And I wanted to be an agent of transformation. But in order to become an agent to transform, in my reality, to transform poverty and to transform inequality, I understood very quickly that I have to work, inside myself, in order to be aware of my strength as well as my weakness, my vulnerabilities. And I did that, Adriana, in various ways. I did therapy, bioenergetic therapy. I did meditation. I do meditation. I read sacred books. And through relationship, in the end of the day, it's through relationship that you build yourself, through friends, family, co-workers. I love the African movement called Ubuntu. I am because you are. So I think that's why I am.
This is beautiful. And this is such an important lesson of leadership because it comes from self-awareness. Every leader that we can think of understands the potentials and understands and reflects about him or herself. So self-awareness is a beautiful lesson. So in that process of acquiring this self-awareness, learning about Vera, so what happened in your life? What were like the highlights of your trajectory, your personal journey, Vera, that you could?
Before I answer your question, I want to highlight that I was aware, talking with my colleagues from Ashoka, other Ashoka fellows, that if you have a hard work, external work, many external work you have to do, it's more important to have a very deep, awareness about yourself. Although you live in without quality in your life, so you can how can I say, in some way have a bad relationship with children, husband, friends, because you stay so focused in your external life that doesn't work. So you need to be a balanced life. That doesn't mean that I have a balanced life, but I try to have.
Yeah, the pursuit of, at least, right? Trying to be mindful and conscious of it and seeking to go back to this balance all the time. So you notice you're detouring and you come back, right? Kind of always try to go back to balance. So this is a good point. So Vera started as a doctor in Rio and became this world-renowned social entrepreneur. What happened in the middle there? So what were the little highlights along the way that you could tell us about?
One treasure of my life was my childhood. Although I have, this angry with inequality since I was very, very little girl, I have wonderful father and mother, and they were moved by compassion. So I have good examples, and that shaped my personality since I was very young. And then, I became a doctor and a general practitioner. I worked during 20 years in a public hospital in Rio de Janeiro, called Hospital da Lagoa, as you said. And when I realized also that I loved psychosomatic. There are people that doesn't understand what psychosomatic means, but psychosomatic is the person behind the disease. Why that person has a heart attack? Who is that person? And the relationship between emotion, thought, and disease. And I was totally devoted to psychosomatic all my life as a doctor. But then, as the head of the psychosomatic department, I went to work in the pediatric service. That was the turning point of my life, because I had two daughters. At that time, Marina was 13 years old and Laura was 10 years old. And I used to travel to go to Lake Tahoe to do on vacation and come back to the hospital. And the mother used to say, Doutora Vera, please raise my daughter. I have no money. I cannot come back to the hospital. I have no money for food. Then I realized, I became aware that, psychosomatic was not enough, because there is an environment where the vulnerable families with poor and sick children, they live. And who cares about this environment? And a lot of disease, the main cause is poverty. So if the disease is just the tip of the iceberg. Behind the disease, there is a jobless father, a depressed woman, it's raining inside the house. So, for example, I treat Priscilla, and Priscilla has pneumonia. Pneumonia is just an excuse for poverty to appear. Then she was cured at that hospital. Then 3 months later, she came back with another disease. So, talking with my colleagues, other physicians, nurses, social workers, I understood that there was a vicious cycle: poverty, hospitalization, rehospitalization, and death. And we want to break this vicious cycle, but how can we do that? So I also realized that we have to go beyond the hospital walls to create something new. In 1991, I founded DARA Institute. The main objective of DARA Institute is to promote health in a comprehensive way, not in the way the traditional medical care use, but in a more holistic way, and to promote human development. So what we do, we create altogether more than 1,600 volunteers, listen to the people we serve in a two-way road. It was not top-down. So we co-create with the family goals they have to achieve every month. For example, goals in the income generation area. So they have to go to professionalizing courses. They have to attend the lectures, and then they have to prove that they have to the lectures, and then step by step they start to increase their income generation. That's just one area. But at that time, they could not understand why, because it's a time in the 90s, all the organizations, they have one main objective. For example, Habitat for Humanity, income generation, todos pela educação in Portuguese, all for education. And we understood, listen very careful for the people we serve. We have to work in 5 areas in a very integrated way. We changed the paradigm of life. I remember we won a prize in Cairo, the most innovative project in the year 2003. And they said, knowing our methodology, that we changed the paradigm of life, including the social determinants of health, that I can explain after that. But more important, because I always have the question in my mind, Adriana, that says, okay, it works. We won the Skoll Award, among others, because we proved that the rehospitalization falls down. But what is the long-term impact of DARA? Then some research from Georgetown University, they conduct research, that in a random way, they choose 120 families like this, around that. And then they choose a control group in another hospital, Hospital Menino Jesus. So to compare one group with DARA methodology and with the control group without DARA methodology. And the results, they were amazing. And they were published in the New York Times, because just to give an example, the income generation 3-5 years later from being released from DARA program, almost double. Related, for example, another example that I can give you is before DARA, 26% of the family, they had their own home. 3-5 years later, 50% of the family, they had their own home. The income double, as I said, and there is a decrease of the average number of days children spend in the hospital of 86%. In terms of well-being, when people came to DARA, if you ask, how is your well-being inside your family? They said it's very bad. And after 3-5 years later, after being released from DARA, it was amazing, because they say their life was wonderful. And when you compare with we make control groups, we study group, led by the control group from Hospital Jesus, another group from DARA Institute. If you ask from the control group that doesn't have DARA methodology, if one health shock comes again in your family, what you do, what you have learned. So people from the control group said, I will pray. And the group led by people that pass through all the programs at DARA Institute, they say, I know how to deal. I know how to navigate in many ways. So that is the Georgetown study.
Okay, let me stop you right there for a couple of observations. So some lessons here that I'm hearing. First of all is you listened. This is also a characteristic that we hear a lot about good leaders. Leaders listen, and you listen to the people you were serving, you were treating, your patients, your families. And you, little by little, with the help of everybody who was a volunteer with you, you were able to understand that it didn't, for you to be effective, you couldn't work only focused on one area of their lives, which was health. So also another characteristic of a leader here, you were very innovative because you changed the paradigm that everybody was used to. Okay, a social entrepreneurship or an NGO has to be very focused. Education, healthcare, income generation. And you understood that in order for you to be successful in treating people around health, you needed to observe other factors. So you created a more systemic approach, an integrated approach. So you were innovative in that regard. And also another lesson that I wanted to point out is you were able to leverage the experiences you had along the way and bring that back, right? So it's kind of weaving in your strengths to the trajectory as a leader, because you were a doctor, you understood about health, but because you were a psychosomatic doctor, you knew that there was more to the disease than just the problem you were seeing. And you investigated it, you listened to that, and you created the ramifications in your project in order to do so. And this might be an interesting example to show our audience how you did it, because if you go back to your story, you started treating patients in the stables of a park in Rio. I mean, you didn't even have an office to treat these people. Can you tell us a little bit how that moment was and what made you start working in that park?
It's a process that I can't believe we passed through. Nowadays, I cannot imagine what kind of energy move us, not myself. I was a volunteer for 12 years, but as I told you, Adriana, during those 30 years, more than 1,600 volunteers, they passed through the institution. So I remember when I started DARA, I didn't imagine what kind of institution I will create with the volunteers and the institutions. But I knew that I need to change the paradigm of life. Of health, the paradigm of health. And there was a stable, large park, a walk distance from the hospital. And I need, in order to have volunteers, I have to be based in a place where people were healthy, they have money to survive, they can be volunteers. So I started in a stable where the horses used to be. The old owner of the park, she had horses 100 years ago. So we started in a stable. We have nothing. We started from scratch. And my husband, he worked for IBM. He was IBM director. He used to travel a lot. And I started ruffling things of my house. When he came back from his trip, he said, "Where's the clock?" I sell it. Became chemotherapy treatment. And then I remember my daughter saying, "We bought tennis, no mother." And they closed their closet. They closed it because they knew I will sell it, to buy medicine and so on. So I was in a different state of consciousness. I don't know, totally out of the status quo. Because I remember one day I was totally in white as the physician in the hospital. I treat the physician in the morning, the patient in the morning. Then I went to the table and I was, selling some clothes. I think, who am I? I'm a physician selling clothes in order to have money. And I remember friends of mine, when I called them, they knew that I didn't want to go to cinema. I want their money. I want I want them to become volunteers. It was a very strange time. But then, and the results, they came very slowly. Only priests believe us. You touched the sacred of human beings, but without money, how can I speak the sacred statement of human being? But the priests believe us. But then, you know, year per year, you know, Ashoka, Avina, Schwab Foundation, Skoll Foundation, they came, you know, to join force with us, you know, and not only to strengthen our methodology, but also to spread it. So we spread it near 23 public hospitals in 6 states in Brazil, and we became public policy in Belo Horizonte, the 3rd largest city in Brazil. So
okay,
that was the point.
So let me stop you right there again. So in the beginning, a lot of determination, because you could see that you could make a difference, but you didn't know how. And you were trying different things. So determination to keep going. You didn't stop. Resilience. Despite all the difficulty you found along the way, you continued to pursue that goal. And with collaboration, which is also a very important lesson for leaders, right? Collaboration, and after you understand what is required, you could express that for the foundations abroad, outside Brazil. And by going out there and expressing your vision and having your case studied by a university with metrics, so being able to really interpret the results you're having in real life in a way that could be communicated, you were able to get collaboration. So determination, resilience, good communication, the right practices, the right techniques to show the results, and then collaboration happened and you became more visible and you became this originator of this methodology to so many states in Brazil, but also countries. So tell me about this spreading the word to the world. How did this happen?
You know, it was through Ashoka and Avina and Schwab Foundation and then Skoll Foundation. I traveled a lot all over the world. So I remember I went to 16 countries and I gave 54 lectures outside Brazil and more than 140 lectures, in Brazil. But so they invite me to go, you know, in the beginning of the year 2000, the Schwab Foundation, especially, they invite us to go to Switzerland to speak. Why people think that you are mad, and you have to explain why you went out of the status quo and how, and what's the main cause behind your behavior. So, but then, you know, I have the chance to change ideas with people with the same mindset. That Bill Drayton, Ashoka founder, said that, you know, that to be a social entrepreneur, you don't give the fish, you don't teach how to fish, you have to change the industry of fishing, you know. You have to. So this is a very, I think, you explain exactly, because in our case, we change the paradigm of health. Health is not hospital center. But more than that, we were able to make a lot of partnership all over the world, you know, making collaboration with other social entrepreneurs. For example, Adriana, now I am in a movement, huge movement of social entrepreneurs. It has more than 3,500 social entrepreneurs. Call it Catalytic 2030. You know, in order to go more faster, to achieve the Millennium Goals. So, but then when what they call client-centered methodology, they started to use, because other social entrepreneurs, they put our methodology in one tablet and they take it all over the world, as I told you, in 4 continents. But finally, they understood that we were the originators. And I received a lot of emails saying, we know that Brazil and Instituto DARA is the real originator. Of course, each country will use different tools, but the methodology behind the tool, the app, everything in technology is Family Action Plan.
Okay, and let's explain that a little bit, because that is the systemic transformation tool. That is you created a methodology that has been proven to really reduce hospitalization and serious health-related issues, but by not necessarily working only with medical treatments, but by doing something else. So let's explain to our audience, what is this client-based approach, and how does it work? The vision you had at that, and how do you connect all the different parts?
Let me try to explain. In the beginning, as I am a doctor, people from hospitals in Rio, they choose the poorest among the poor, because we wanted the more vulnerable families to start with very vulnerable people.
They didn't have any access to any kind of treatment. It was very hard for them to get treatment.
They didn't have the money to come back for treatment again to the hospital. They didn't have food, anything. They were the most vulnerable among the poor people.
And one special comment here. In Brazil, you have universal health. So there is, anybody can go to a hospital and try to get health, but there are long lines, and the treatment is not so good, and it's not available to everybody, especially if you live far from a public hospital, right?
Yeah. We have a wonderful system called SUS, Sistema Único de Saúde. The idea is wonderful. It's all over the country, but in nowadays there's no resources. The physicians is not well paid, so they started to give up. So it's a wonderful idea. It's like in England, the public service in England. But in England, they have money, they have research, they have good governance. So I have to explain that SUS is wonderful, but it has to be very well implemented to really treat people. So those vulnerable people that we treat from various hospitals, they came to us, but not only them. We understood that methodology were able to help poor students from different schools, for example, in Rio or and elsewhere, in other countries. Schools, social centers, hospitals, where vulnerable people live, can be chosen and can be treated by the Family Action Plan. What exactly we do? When a family comes to DARA, Instituto DARA Institute, the first thing that we do is a diagnosis, but not a medical diagnosis. That involves, the nutritional part of how the family eats, what she eats, what they eat in the family. How is the health of the entire family, not only of the responsible of the family, but the children, the father, the grandfather, the family as a whole. Then, what is the diagnosis regarding the house? So a social worker visits the house to see how is the house. Normally, it's worse than they talk about. When they go there, because poor family, they are ashamed about poverty, because they feel they are guilty. They provoke poverty. And when you go to visit them, there's no word to explain the state of the house. So we have diagnosed in the 5 years: health, education, what is the background of the mother, the father, the children, housing, income generation. That is crucial, because when they came to us, we say to them, we'll give you a lot of food if you need, a lot of medication, because you are very poor. But just this is the beginning of the program. What is your talent? Because you have talents. I know you have talent.
Everybody does. Good.
Everybody has.
Good point.
So in the beginning, they say, oh, I'm depressed and blah, blah, blah. But then, talking with other families around them, listen to their stories, they started to say, oh, I like to cook. So we send them to professionalizing cook lessons. Every month, we started to follow up them in not only talking with them, in a presential way, but also we monitor them to a very sophisticated IT system. For example, if you are a psychologist, you know what's happened in the health area, you know what's happened in the housing area, in the income generation area, you know everything. You have access to different aspects of that family. So,
and how long does this plan take? Because the family comes, the patient comes, so the family comes with the patient, and then you do the plan for the whole family in all the different areas. And how long is this plan good for?
The plan, in average, takes 2 years. But let me explain what exactly is the plan. For example, you are a mother. So your first visit to the institution, no matter what place in the world, we will co-create, it's not top-down. I will help you to realize in what point in your life you are now. There is domestic violence in your life, housing, what is the shape of your house, there is dignity in your house or not. So we co-create some goals. For example, I noticed that all your children in the age of school are not at school, they are out of school. So you commit yourself next month to show that all the children they are at school. So that goals, they happen in those 5 areas.
So you build the goals together with the patient or the family. They commit, they sign off, and they say that they will do it. So you will be working with them, offering them help and guidance, but you work with them so that they can go improving aspects of their lives as they go, correct?
Correct. What's wonderful, what's very beautiful in that methodology, because since the beginning, we have not only employees, we have volunteers. As I said, more than 1,600 volunteers. And it's a win-win, is a two-way road, because the volunteers, they stay there for 30 years, and what they earn values. They used to say, I receive more than what I gave to them. So what they receive, they change their value. Instead of complaining that their hair is falling down, they knew how heroic that family in front of them, they are selling at 5 a.m., cooking at the metro station, and they feed the 4 children. So they stop complaining, the volunteers, and they help build the family action plan. So when the health area, the housing area, education area, income generation area, and citizenship, because poverty is not only a lack of money, it's the lack of knowledge. They don't know they have rights from the government. So we explain them how to go receive the benefit that they deserve. So when all the aspects of their life, we have very clear criteria. I have no time to explain now, but we have criteria for each area, health area, and those 5 areas. When they reach that criteria, and all the areas they agree that the family can walk by themselves. They have income generation, they have self-esteem, they can go by themselves. They have auto. We say we finish the program in every 2 years. They finish the program, and another family comes to our program.
Okay, so 2 years, and you empower the individual and the family, and you have metrics, and they are guided through a process. So you work in collaboration with them, but it's co-creation. They get to say if they want to do it, but you help them with ideas, with guidance, with best practices, correct?
Yeah. If you don't have a deep connection with a family, the family action plan doesn't work. And since the beginning, like a mantra, like Alcoólatras Anônimos, AA, in Brazil, we repeat the rules of DARA. They know that they have to be committed with the goals, because although they will be out of the program, because it's not assistencialismo, how I say that in English. We don't want them to become, addicted to food, medication. They have to change their lives.
Yeah, it's not just the philanthropy,
external,
and depending upon the donations, but it's a mindset change. It's actually a behavioral change, right? But they are guided, they're helped with knowledge, like you said, to see what they can do, and they are assisted in the process of changing the way that they behave and in the different areas of their lives, right?
They have to understand they are the protagonists of their life.
Beautiful.
We can support them, but they are the protagonists of their life.
So what I'm hearing here, Vera, correct me if I'm wrong, this is a regenerative story in the sense that you, with your knowledge and your volunteers' knowledge and your plan, you help the person create their own self-awareness, commit to goals, and by doing that and following that program for 2 years, they can regenerate. They can regenerate their ways of living and relating to each other, the families, and the diseases, at least to some extent, will not come back or will not be as recurrent as they were before, right?
Yeah. And, in the beginning, we thought it was a health problem. It is a health problem in a integrated, in another concept, not the traditional health care. In another paradigm, it's a health problem.
Systemic way, yeah.
Systemic way. It's a system change way to see health, but also it's a way to promote social inclusion, to fight poverty.
Mm-hmm.
Because, it works for schools, for social centers, for many other organizations.
Yeah, you help connect the dots. It's all, in systems thinking, we say it's all interconnected. And what you're doing with the methodology at DARA, you're making it visible, where to connect, how it connects, and how you can leverage the connection to improve something.
Yeah, there is something that makes me very happy, because we made an internal research asking the family, what is health in your opinion? The result, what was a surprise for me, totally surprised, because I thought they will relate to body or to mindset. I don't know. I thought many things. You know what word they use the most in the research? Health is opportunity.
Interesting. Health is opportunity. And why do you think that is their answer?
Because, as Muhammad Yunus says, the poor, the very poor man and woman, they are like a bonsai. I don't know how to say that in English.
The small tree, the Japanese
small tree.
Trimmed.
People normally say, oh, they have to grow up. They live in an environment that they cannot grow up like a huge tree. But they have no resource, no internal resource, no external resource. So opportunity is a good name for DARA, because it's not only external opportunity to do professionalizing courses, to be more able, but also opportunity to know themselves, because they come back, they came to us. The volunteers, they say, when the mother came, I say, oh, that woman, there's no solution. And 6 months later, there's another woman in front of that volunteer. Because the body language. She changed the way she talks, the way she sees. She connects with her essence, So DARA gives opportunity to internal as well as external work.
So you're transforming the community, the families you assist, but also the volunteers get transformed by the experience that the interaction. This is very systemic too. I love, this is reminding me of Humberto Maturana that says that we evolve in this language, the conversations, the experiences we share with one another, because we're cultural beings, right? So what you're saying is exactly that. You allow the families that you are assisting to transform themselves, but also the people working with the families get transformed in the process.
Totally. Because, if you live in a society like Brazil, like Rio de Janeiro and other cities, big cities in Brazil, the upper class doesn't speak with the middle class, and that doesn't speak with the poor and the poorest. So there is a lack of bridge between all the social classes. And everybody loses. We are all losers. Because it's only a lack of money, but they are wiser than many rich people. So what the volunteer learn, they learn wisdom to live. And that's very beautiful. Another thing that I learned, Adriana, it was with Dr. Yolanda Abulu. She's a nurse from Maryland University. She discovered us. So she came back to Brazil, and she visited us, and we stayed with her for 4 years, transferring the methodology to the United States, another culture, to Baltimore. She made a coalition of NGOs in Baltimore. It's very similar to Rio. And, she is applying in a pilot group the Family Action Plan, exactly what we do. And before doing that, she was involved with other researchers. She's a PhD woman, she's very clever. She was involved with social isolation. And she discovered that social isolation, like poverty, is the reason of many diseases. Social isolation is also the main cause of many diseases.
Wow. So, and now with COVID, my goodness, we have social isolation to the extreme in the world.
Can you imagine? So social isolation leads to obesity, diabetes, hypertension, among other diseases.
Interesting.
And so people cure people, if you have love, if you have a deep relationship, you cure, and you have been cured by others. So it's a two-way road again. So nowadays, as you said, with COVID-19, it's fundamental to apply Family Action Plan everywhere. Never has been so crucial like today.
Yeah, so just to recap here for our audience. So this lady from the United States, she was applying your methodology even before COVID, because she already identified isolation as being a big trigger for many health-related issues to the communities in the United States. And the methodology that you developed, connecting the dots, making the family plan, is helpful in that circumstance as well. Yeah. So now with COVID, we might have to look at this even closer, because the level of isolation created by the necessity to prevent the disease, to stop the spread, probably is creating circumstances like that all over the world.
Yes, but the truth is, as she grew up in a very poor neighborhood in Baltimore, Yolanda, she understood more than other health professionals that the environment was crucial, to deal with the healthcare system. She didn't know, she made a lot of research, and she realized we were the originators that proved that social determinants of health is crucial, to navigate in the healthcare system. Also to make the change of the paradigm of health. So she looked at us because social reasons, because of social isolation and because she knew we were the pioneers of social determinants of health, studying social determinants of health.
That's beautiful. So this is the result of your life's work, and it's so good to see that it's spreading to other parts of the world as well. You also mentioned South Africa to me before we had this interview. Can you tell us what's going on in South Africa?
Yes, there is a leader, Laura Berg. She, after knowing our methodology through another social entrepreneur, she learned what they call client-based methodology. That is the family action plan. At the end of the day, is the family action plan. And because she has like 60 organizations dealing with the client-based methodology, she came back to me. She asked me to make a Zoom call with her. And she said, I discovered that you are the originator of that methodology, and I want to honor you. Because, when you have a successful child, everybody wants to be the father and the mother. And there is a lot of misunderstanding. But she, as one of the leaders of Catalyst 2030, this huge movement of more than 3,000 social entrepreneurs, she understood, she and others led Jeru Bilbao, she led this movement. They discovered that she called us the originators. And they are applying in many countries, as I said, in 4 continents. That methodology started in a stable, is in 4 continents. That's amazing.
It is amazing. Congratulations, Vera, because it is amazing. And you are the originator. And the more people understand the model and apply the model, the better. But nothing will replace the learnings in this over almost 30 years that you have been in the journey. So contacting you for all the to understand the what happened in between, because it's easy to see now because you have the study and you have the success story to share. But how you built it, there are many learnings along the way, right? That you, as having gone through that experience that yourself with your team, might be able to share to the ones who want to adopt that globally.
And Adriana, I would like to point out that it was when people say, you are the originator. When I say myself, I represent, 1,600 volunteers, Ashoka, Avina, Schwab, Skoll. It was not myself who created the Family Action Plan. I was unable to do that. It was, many national and international organizations, very serious ones like McKinsey, Ashoka, Avina, Schwab, Skoll. They joined force with us to create this very successful methodology. I remember Muhammad Yunus saying that DARA create a very powerful methodology to include the poorest among the poor. And he visited us, when Dr. Ruth Cardoso, the former wife of our former president, Fernando Henrique Cardoso, she visited us. In fact, she inaugurated our first, after the stable, our first headquarters.
And she was an anthropologist, and she understood the power of societal organizations and how to empower the network. So I'm glad to hear that she did that when she was with us.
Adriana, she said to me, I never forget this, because she said she built a program called Comunidade Solidária, and she said all that Comunidade Solidária aims, all the objective of Comunidade Solidária is here in this Instituto DARA. She's in DARA, so it was an incredible day.
Such a blessing. She was a very illuminated person, and I'm glad to see that the two trajectories connected. Okay, we're getting to the end of our conversation here, and I would like for you to share a message with our audience. So for the different people watching us, what will you tell them to guide them in their journeys?
And what I want to say is, We have to believe in small steps, one by one, every day, without expecting any result, just doing, making, some problems, some progress, just doing small steps and celebrating it. It's very important to celebrate it. We don't have to wait for results. They will come. Because when we commit ourselves, good fortune will come. With ourselves without expecting results. Good fortune will come in a way that we are not able to understand, and in a way that is impossible to predict. That's incredible.
It's the synergistic effect, right? It's beautiful. So take step by step, celebrate each win, and wait for this magic to come, because you're with the right purpose, going in the right direction, collaborating with people, synergy will happen.
You summarized what I want to say.
Thank you so much, Vera. It's a pleasure to talk to you and to understand more about DARA. I hope our audience will be curious to learn more, and you can spread the word, and hopefully with this more systemic approach, we can definitely make a huge change, not only in Brazil, but in the world. So thank you very much for the wonderful work you do.
I thank you deeply for that opportunity to share not only our methodology, but the history of behind our institution. Thank you, Adriana, very much. Thank you.
Thank you, Vera.